Joint pain is rarely the only symptom. It may also be accompanied by swelling, redness, and limited mobility. The causes vary widely and can include infections, injuries, rheumatic diseases, degenerative changes, overuse, and even certain medications. In the past, special medicinal herbs were commonly used to relieve joint pain. Today, because science has identified the mechanisms behind many of these plants, it is possible to choose herbal remedies more precisely. Now, let's take a look at some of the most popular herbs used for joint pain from various causes. Boswellia serrata. Boswellic acids have anti-inflammatory and pain-relieving properties. They may also help prevent cartilage loss and suppress the autoimmune processes associated with rheumatoid arthritis. A 2008 study found that Boswellia extract reduced arthritis pain by up to 65% within just 7 days, commonly used as capsules, tablets, standardized extracts, or ricin-based supplements. It is usually taken orally. Devil's claw. Devil's claw contains harpagoside, a compound known to help reduce joint pain. A 2002 study found that 50% to 70% of participants who took 60 milligrams of the extract daily reported reduced pain, improved mobility, and greater flexibility after 8 weeks. Most commonly used as capsules, tablets, liquid extracts, tinctures, or herbal teas made from the dried root. It is generally taken orally. Ginger. Ginger has powerful anti-inflammatory properties and is believed to act as a COX-2 inhibitor, similar to some arthritis medications. The compounds gingerol and shogol found in ginger have been shown to reduce pain and stiffness by up to 40% compared with a placebo. Can be consumed fresh, dried, as tea, powder, capsules, extracts, or added to foods and drinks. Turmeric. Curcumin. The active compound in turmeric blocks inflammatory cytokines and enzymes. Some studies suggest it may reduce joint pain even more effectively than diclofenac, one of the most commonly used non-steroidal anti-inflammatory drugs, typically used as a spice, powder, capsules, standardized curcumin supplements, or herbal drinks. It is usually taken orally. Cat's claw. Cat's claw is a natural anti-inflammatory herb that inhibits tumor necrosis factor, TNF, a major target of rheumatoid arthritis treatments. A study published in the Journal of Rheumatology in 2002 found that it reduced joint swelling and pain by more than 50% in patients with rheumatoid arthritis compared with a placebo. Commonly consumed as capsules, tablets, liquid extracts, tinctures, or herbal teas prepared from the bark and root. Rose hip. Rose hip powder helps reduce inflammation by inhibiting the production of inflammatory proteins and enzymes, including COX-1 and COX-2. A 2008 meta-analysis of 3 clinical studies found that rose hip powder reduced hip, knee, and wrist pain by approximately 1/3 in nearly 300 patients with osteoarthritis, usually taken as powder, capsules, tablets, syrups, extracts, or herbal tea. Pineapple. Pineapple is rich in bromelain, an enzyme found in pineapple juice that is often used to reduce swelling and inflammation. It may help relieve joint pain and prevent muscle soreness after intense exercise, consumed fresh, as juice, or as bromelain supplements available in capsules and tablets. Fireweed tea, Yvonne tea. Thanks to its high tannin content, fireweed tea may help reduce inflammation. The amino acids found in the plant support collagen production, which is important for healthy joints. Regular consumption may produce noticeable benefits within 2 weeks, most commonly prepared as an herbal tea or infusion made from fermented or dried leaves. Mountain Arnica. Arnica is commonly used to relieve muscle and joint pain. Its lactones interfere with the inflammatory process by suppressing the production of nuclear factor kappa beta, NF-κB, an important inflammatory mediator. It has been reported to provide relief in many cases. Arnica is toxic if swallowed and should only be used externally. Arnica should not be swallowed unless used in specially prepared homeopathic products under appropriate guidance, usually applied externally as creams, gels, ointments, oils, or topical preparations. Licorice root. Licorice root helps reduce free radicals at sites of inflammation and inhibits the production of enzymes involved in the inflammatory process. Glycyrrhizin is one of the key compounds responsible for its anti-inflammatory effects, often consumed as tea, capsules, extracts, powders, syrups, or tinctures. Marsh Cinquefoil. The roots of Marsh Cinquefoil have long been regarded as a natural pain reliever. Herbal books dating back to the 17th century contain recipes featuring this plant. Decoctions made from its roots have traditionally been used to help relieve pain and reduce inflammation associated with osteoarthritis and arthritis. Traditionally used as herbal teas, decoctions, tinctures, extracts, or topical preparations made from the roots and rhizomes. Burdock. Burdock possesses anti-inflammatory properties due to its content of fatty acids, sterols, and tannins. It has traditionally been used to support joint health and reduce inflammation, commonly consumed as tea, decoctions, capsules, extracts, tinctures, or as a food in some traditional cuisines. Some herbs should be taken internally as teas, infusions, or decoctions, while others are toxic and should only be used externally. Moreover, although they have medicinal properties, they can also cause side effects, especially when used improperly or in excessive amounts.